Hello, my name is Ellen Snowball, and I'm a research analyst at Toronto Rehabilitation Institute, which is part of University Health Network. As part of our Research Digest series, I will be presenting a few research studies from our Enhancing the Care of the Older Adult, or ENCORE, team. Today we are summarizing Context Matters when implementing patient-centered rehabilitation models for persons with cognitive impairment, a case study by authors Catherine Magilton et al. The keywords for this article are cognitive impairment, rehabilitation, older adults, and focus groups. The research questions for this article are: what are the elements of the context already in place to support the implementation of the patient-centered rehabilitation model? What elements of the context could be introduced to strengthen chances of successful implementation? Why is this important? Different contexts affect how we apply rehab models for older adults, especially those with cognitive impairment. Learning more about this can help with fitting these models into new contexts. This can lead to better outcomes. Background: implementing evidence-based models requires ensuring that the intervention fits the context. The context and implementation of complex interventions, or CC, framework is a tool that can be used to help understand context. It has 7 domains for assessing different contexts. A patient-centered rehab model for people with cognitive impairment has shown positive outcomes. This model was introduced in a new context, a rural facility in Ontario, Canada. After 6 months, focus group discussions were held to assess elements of the context. Methods: a case study was used to examine the context in a rural facility in Ontario, Canada. 4 focus group discussions were held with 27 healthcare workers. Participants talked about elements within the context, including those that might influence the introduction of a patient-centered rehab model. Transcripts from the discussions were analyzed using the CC framework. Definitions: context includes the population being served, the different providers who deliver the services, the diversity of the settings. Case study: an in-depth study of one group, person, or event. Focus group: a group interview involving a small number of people. CC framework: a tool used to understand context. Results: 3 main domains had an impact implementing the patient-centered rehab model. These 3 domains were political, epidemiological, and geographical. Some of the key elements included: epidemiological domain. Existing elements included using specific models of care, involvement of family. Required elements included incorporating routine as well as familiar elements and an individualized care approach. Political domain. Existing elements included effective teamwork, education provided to staff, and weekly team rounds. Required elements included role clarity among team members, staffing to match patient care needs, and leadership to create a vision and action plan. Geographical domain. Existing elements included making use of the physical environment to incorporate therapy activities. Required elements included redesigning the unit's work area to support staff collaboration. Conclusion: the CC framework helped in finding key factors within the context. When applying a new model of care, attention should be paid to the political, epidemiological, and geographical domains of the context. Please visit our website at www.encoreteam.com, where you can learn more about the Research Digest and find a PDF version. If you have any questions or require more information, please email us at ellen.snowball@uhn.ca.